Welcome to the deep dive. Okay, so you've got your revision notes on lead poisoning, and you want a focused session to really lock it in. That's what we're doing today.
Exactly.
Think of this as your high-yield power hour, cutting through the noise to make sure the key stuff sticks.
Yeah, making it digestible.
Our mission, get you feeling confident about lead poisoning, covering all the bases, definition, causes, right through to management and complications. Ready?
Let's do it. So lead poisoning, fundamentally, it's just when lead builds up in the body to levels that cause harm.
Right.
Usually gets in through swallowing it or breathing it in. But the real kicker is how it messes things up once it's inside, especially this process called Haem biosynthesis.
Hem biosynthesis.
That's making Haem right.
For red blood cells. So lead just disrupts the factory.
Pretty much, yeah. It inhibits or blocks key enzymes in that production line, like throwing a wrench in the works.
Okay.
And the result, you get hypochromic microcytic anemia.
Meaning smaller, paler red blood cells.
Yeah.
Less oxygen carrying.
Exactly. Plus, lead also interferes with erythropoietin. That's the hormone signaling for more red cells. And it even makes the existing red cells die off faster. It's hitting your blood from multiple angles.
Wow, okay. Not simple. And the notes mention nerves and kidneys, too.
Oh, yeah. Lead's a known neurotoxin. It's particularly nasty for developing brains, which is why it's such a huge worry in children. Chronically, it can lead to irreversible kidney damage, this thing called interstitial nephrosis, and that can cause high blood pressure down the line.
Okay.
We even see actual structural changes in the brain, and it messes with steroid hormone production too. It really gets around the body, but loves the nervous system and kidneys.
A systemic troublemaker, then. The notes distinguish between acute and chronic poisoning. What's the key difference there?
It's mostly about the exposure. Acute is usually a big dose all at once, maybe breathing in fumes at work, or a kid swallowing something with lead in it.
Right, a sudden hit.
Yeah. Chronic is more like a slow burn, lower levels, but over a long time. Environmental exposure, maybe from old paint, or ongoing occupational risk.
Got it. Quick hit versus slow buildup. And there's a diagnostic tip here. Suspect lead if you see abdominal pain and neurological signs. Why is that combo so important?
Because that pairing should absolutely make you think, could this be lead? Abdominal pain is common? Sure. But when you add weird neurological stuff, confusion, weakness, behavior changes.
Especially if there's a potential exposure source.
Exactly. Then lead poisoning jumps way up the list of possibilities. It's a classic, though sometimes missed, clue. And just to link back to the Haem synthesis.
Yeah.
Remember those enzymes it blocks? Ferrochelatase, the one that puts iron into Haem, and ALA dehydratase. That's how it causes so many problems. Maybe you think, lead hinders Haem.
Lead hinders Haem. Okay, that's catchy, easy to recall. Good. Right, moving on to etiology. Where does the lead actually come from?
Well, historically, a massive source was lead-based paint, especially in older houses.
Right, the flaking paint, the dust.
Exactly, which kids can easily ingest. Then you've got contaminated soil, sometimes water, air pollution near old industrial sites.
Still relevant today.
Definitely. Plus, certain jobs are high-risk mining, making batteries, and sometimes imported things like toys, cheap ceramics, even some cosmetics can contain lead.
Wow, okay. So it's a mix of old problems and some ongoing risks, too. Who's most likely to be affected? Who's at highest risk?
Top of the list, children.
Especially under 5.
Why them specifically?
2 main reasons. Their bodies absorb lead way more easily than adults, like almost twice as much from the gut. And their brains are still developing, making them super vulnerable to the neurotoxic effects.
Okay, that makes sense.
So kids in older housing or whose parents work in lead industries are at higher risk. Also, people living near contaminated industrial zones or anyone whose job or maybe hobby involves lead.
Let's drill down on the jobs. The notes give quite a list. Yeah, it's pretty broad. Think about making or handling radiation shields, bullets, some older surgical equipment. Historically, developing dental x-rays, though that's mostly digital now.
Right.
More current risks could be working with fetal monitors, old plumbing, circuit boards, jet engines, making ceramic glazes. The common theme is potential exposure to lead dust or fumes.
And higher exposure means higher risk.
Absolutely. Dose and duration are key.
And it's not just jobs, right? Hobbies, too.
Definitely. Things like fishing, handling lead weights, maybe putting them in your mouth, or making bullets where you can inhale dust. You can maybe remember lead in leisure can leave you less healthy.
Lead in leisure. Okay, and there were some other maybe less obvious risk factors mentioned?
Yeah, a few. There's pica, That's when people, sometimes adults with mental health conditions, deliberately eat non-food items.
Okay.
Some imported traditional remedies or tonics, even cosmetics, can unfortunately be contaminated. Interestingly, being iron deficient actually increases how much lead your body absorbs.
Really? Why's that?
The body's absorption pathways for iron and lead are similar. So if you're low on iron, the body might grab onto lead more
Oh,
readily.
yeah.
And then the big ones we mentioned, older houses with lead paint or pipes. And just the simple risk of kids chewing on things. Windowsills, toys, fishing weights, bullets, even just playing in contaminated soil.
It really seems like it could come from anywhere if you're not careful. So how does lead actually do the damage, the pathophysiology?
Basically, lead is an imposter. It chemically resembles essential minerals, calcium, zinc, iron.
Right.
So it kind of elbows its way into biological systems where those minerals should be, disrupting enzymes, messing with cell signaling, basically gumming up the works at a cellular level.
Like a saboteur inside the cell.
Exactly. And so in the nervous system, that leads to developmental problems, learning issues, behavior changes, especially in kids. In the blood, you get the anemia, poor red cell function, gut abdominal pain, constipation, loss of appetite. Kidneys reduce function. It hits multiple systems. Maybe remember, lead lads lack life in cells. Bit grim, but maybe memorable.
Lead lads lack life in cells covers the broad impact. Okay, now, differential diagnosis. What else looks like lead poisoning?
Yeah, this is important because the symptoms can be vague. You absolutely have to consider iron deficiency anemia.
Okay.
Other heavy metal toxicities, mercury, arsenic.
Yeah.
In kids, you might think about ADHD or autism spectrum disorder, especially with the behavioral changes.
And if lead poisoning isn't common where you practice?
It might just not be on your radar, making it easy to miss. That's why that abdominal pain plus neuroscience clue is so vital.
Right, keep it in mind.
And the notes give a longer list to other causes for the specific symptoms like abdominal pain, confusion, memory loss, neuropathies.
Lots of possibilities.
Yeah, various nerve problems, seizures, other encephalopathies, depression, learning disabilities, even solvent poisoning could mimic parts of it. For specific nerve issues, you might think radial nerve palsy or diabetic neuropathy. For the gut or blood, other anemias, constipation causes, even Guillain-Barré if weakness is prominent. It can be complex.
Sounds like real detective work sometimes. What about the epidemiology here in the UK? How common is it now?
Well, the good news is regulations getting lead out of petrol and paint have made a massive difference. Cases are way down.
But not zero.
No, definitely not zero. We still see it. Higher-risk groups are still kids in older housing, certain occupational groups, and sometimes immigrants from places with fewer regulations.
Okay.
And crucially, even lower-level chronic exposure, especially in kids, can cause permanent neurocognitive and behavioral issues. Adult cases now are mostly job-related smelting, battery work, scrap metal. Just remember, regulations reduce risk, but vigilance remains vital.
Vigilance remains vital. Good point. Let's get into the clinical features. What signs and symptoms do people actually present with?
It's a real mix. Common things are that abdominal pain, developmental delays in kids, thinking and learning problems, irritability, behavioral stuff, tiredness, weakness, headaches. Pretty not specific, often.
Which makes diagnosis tricky. Any more specific clues?
Yeah, peripheral neuropathy, often motor, affecting movement can occur. Constipation is pretty common too, that famous blue line on the gums, Burton's line.
Yeah.
Often talked about, but actually not that common. Rare in kids, maybe only 20% of adults with lead poisoning get it. So don't rely on seeing it.
Okay. What about acute poisoning? Really high levels.
That's usually much more dramatic. Severe abdominal pain, vomiting, maybe encephalopathy, that's brain involvement, causing seizures, mania, delirium, even coma.
Scary. More common in kids, you said?
Yeah, kids are more prone to the encephalopathy part. You might also see jaundice if the liver is affected, severe lethargy from hemolytic anemia, and sometimes black diarrhea. Think, high lead hits hard and fast.
High lead hits hard and fast.
Got it.
And chronic, the slow burn.
More insidious. Maybe milder abdominal pain, persistent constipation, losing weight, personality changes like aggression or antisocial behavior.
Subtle changes.
Can be. Also hearing loss, fertility issues. The motor neuropathy often starts with foot drop, later maybe wrist drop, carpal tunnel. Gout can happen too, and issues with the autonomic nervous system.
So a really wide spectrum. Okay, investigations. How do we confirm it?
The gold standard is the blood lead level. That's the key test. Generally, anything over 10 micrograms per deciliter, or 0.48 micromoles per liter, is considered elevated and needs attention, though ideally it should be much lower, especially in children.
Okay, blood lead level first. What else?
A full blood count, an FBC, Look for that microcytic hypochromic anemia, and specifically for basophilic stippling in the red cells. That's quite characteristic, though not always present.
Basophilic stippling.
Right.
Anything else?
In specific cases, X-ray fluorescence, or XRF, can measure lead stored in bones, giving an idea of long-term exposure.
What about other lab tests?
Well, the blood lead level itself guides management. Below 10 mg/GDL is generally okay for adults, but for kids, you want it as low as possible. Around 45 mg/GDL, gut symptoms are common. Get up to 70, and encephalopathy risk is high. Over 100 is a definite emergency.
Okay.
You check kidney function UNEs, creatinine, and maybe uric acid if you suspect gout. If there are nerve symptoms, nerve conduction studies can confirm neuropathy. And psychometric testing might be needed for cognitive issues, but really, blood lead level is best.
Blood lead level is best. Clear. What about imaging? X-rays.
Sometimes useful. In kids, a plain X-ray of their long bones might show these dense lines called lead lines, indicating growth disruption.
Okay.
If you think someone swallowed something like a paint chip or a weight, an abdominal X-ray might show radio-opaque flecks.
Right, you might see it.
XRF we mentioned for bone lead. And if someone has symptoms of encephalopathy, a CT or MRI scan of the brain is important, mainly to rule out other causes, but also potentially showing changes related to lead.
So, blood tests are primary, imaging is more targeted. Once it's diagnosed, how do we manage lead poisoning?
Number one, absolute top priority. Identify the source of the lead and remove it. Stop the exposure.
Crucial first step.
Absolutely. Without that, any other treatment is just temporary. If lead levels are high enough, we use chelation therapy.
Chelation?
Yeah, using medications that bind to the lead in the bloodstream, forming a compound that the kidneys can then excrete in the urine. This basically helping the body get rid of it faster. And of course, supportive care for symptoms.
The notes list a few chelating agents, DMSA, EDTA. How do you choose?
It depends. We've got succemer, which is DMSA, D-penicillamine, calcium disodium editate, EDTA, and dimercaprol, BAL. The choice depends on severity, age, how well the kidneys are working, and whether the person can take oral meds or needs IV or IM injections.
Okay.
Severe cases, especially with encephalopathy, need immediate hospital treatment, often with IV or IM chelators like EDTA, sometimes combined with BAL.
And for less severe cases?
Chelation is generally started if the blood lead is 45 mg/GDL or higher. We might consider it between 20 and 45 if the person has significant symptoms. For these milder to moderate cases, oral agents like DMSA or D-penicillamine are often used.
Right.
And if a child swallowed a lead object, getting that out, maybe endoscopically, is urgent. It's also important to stop chelation gradually to avoid a rebound effect, where lead stored in bone leaches back into the blood. But the main message, remove the lead, then treat with chelation if needed.
Remove, then treat. Clear pathway. What's the long-term outlook, the prognosis?
It really varies. Depends heavily on the level of exposure, how long it went on, and how quickly treatment started.
So early intervention is key.
Massively. If caught early and the source is removed, people can recover well. But unfortunately, untreated or prolonged exposure, especially in childhood, can lead to permanent neurological damage and developmental issues.
That's serious.
It is. Globally, lead poisoning still causes a significant number of deaths, especially among children. Acute lead encephalopathy in kids often results in severe lifelong brain damage. And we now think there's no truly safe level of lead exposure.
There's no safe level. Wow.
Yeah, and there's emerging evidence linking childhood exposure to a higher risk of neurodegenerative diseases like Alzheimer's later in life.
That's incredibly concerning. Which brings us back to prevention. What are the key strategies?
Prevention is everything. Removing lead paint safely from older homes, replacing old lead water pipes, these are huge.
Public health measure.
Exactly. Ongoing efforts to minimize exposure even below that 10 mg/DDL level. If you find a case, screening family members or coworkers is important. Workplace safety regulations, like say law in the UK, are critical for protecting workers. The global phase-out of leaded gasoline was a major success, but new sources pop up, like contaminated spices or folk remedies, so vigilance is needed. Reducing occupational exposure in demolition, construction, recycling is still vital. Some places, like Uruguay, have shown that coordinated efforts across different sectors work best. Remember, prevention protects precious people.
Prevention protects precious people, a really important message. Lastly, what are the complications we need to be aware of?
Well, the main ones stem from the damage we've discussed. Long-term neurological problems, cognitive impairment, learning disabilities, behavioral issues, permanent kidney dysfunction, chronic anemia.
Basically, the systems it targets.
Yeah, liver, kidney, brain damage are the big concerns. And one other thing, while chelation therapy is necessary in severe cases, it's not entirely without risk itself. It could occasionally cause temporary spikes in blood pressure, raised intracranial pressure, or even acute kidney injury from the lead compounds being flushed out. So it needs careful monitoring.
Right, so even the treatment needs careful handling. Okay, well, that really covers the spectrum of lead poisoning. A sobering reminder of how harmful it can be, but also how much prevention and early action matter.
Absolutely.
We've gone from definition and causes through to management and those long-term consequences. Hopefully this deep dive helps solidify it for your revision.
Yeah, hope it was useful.
For more high-yield revision resources, definitely check out pastthemsetsray.com and also freemsra.com. Thanks for joining us on the deep dive.